Good day. I'm Florida Iso from Level 2 Section A, and I'm going to discuss about medications to avoid during pregnancy. There may come a time during pregnancy when a woman is feeling under the weather and isn't sure if she can take her regular over-the-counter medication. Some medications are safe to take during pregnancy, but others are not, or their effects on the baby may not be known. Many women, assuming that the rule of being cautious with drugs during pregnancy applies only to prescription drugs, take over the counter drugs or herbal supplements freely. Although not all drugs cross the placenta, heparin, for example, does not because of its large molecular size, most do. So, how do drugs cross the placenta? Drugs taken by a pregnant woman reach the fetus primarily by crossing the placenta, the same route taken by oxygen and nutrients, which are needed for the fetus growth and development. Some of the fetus blood vessels are contained in tiny hair-like projections or villi of the placenta that extend into the wall of the uterus. The mother's blood passes through the space surrounding the villi or intervillous space. Only a tiny or thin membrane or placental membrane separates the mother's blood in the intervillous space from the fetus blood in the villi. Drugs in the mother's blood can cross this membrane into the blood vessels in the villi and pass through the umbilical cord to the fetus. Drugs that a pregnant woman takes during pregnancy can affect the fetus in several ways. They can act directly on the fetus, causing damage, abnormal development leading to birth defects, or death. They can also alter the function of the placenta, usually by causing blood vessels to narrow or constrict, and thus reducing the supply of oxygen and nutrients to the fetus from the mother. Sometimes the result is a baby that is underweight and underdeveloped. They can cause the muscles of the uterus to contract forcefully, indirectly injuring the fetus by reducing its blood supply or triggering preterm labor and delivery. And they can also affect the fetus indirectly. For example, drugs that lower the mother's blood pressure may reduce blood flow to the placenta and thus reduce the supply of oxygen and nutrients to the fetus. Moving forward, let's talk about pregnancy risk categories of drugs. The concern about medication use during pregnancy and lactation has been influenced by historical events including thalidomide crisis in the 1960s and teratogenic effects discovered related to the use of diethylstilbestrol in 1971. These events led the U.S. Food and Drug Administration to establish strict regulations regarding drug labeling, the use of medication in pregnancy, requiring demonstrations of safety and efficacy of any drug before it becomes commercially available. To identify drugs that are unsafe during pregnancy, the U.S. Food and Drug Administration, or FDA, has established 5 categories of safety. Always look for a drug listed category before administering it to a pregnant woman. The first category is Category A. Adequate studies in pregnant women have failed to show a risk to the fetus in the first trimester of pregnancy. There is no evidence of risk in latter trimesters. For example, thyroid hormone. Second, Category B. This is described as animal studies have not shown as adverse effect on the fetus, but there are no adequate clinical studies in pregnant women. For example, insulin. Third, Category C. Animal studies have shown an adverse effect on the fetus, but there are no adequate studies in humans, or there are no adequate studies in animals or humans. Pregnancy risk is unknown. For example, docosahexaene, sodium, or colase. Fourth, category D. There is evidence of risk to the human fetus, but the potential benefits of use in pregnant women may be acceptable despite potential risks. For example, lithium citrate. And lastly, category X. This means studies in animals or humans show fetal abnormalities or adverse reaction reports indicate evidence of fetal risk. The risk involved clearly outweigh potential benefits. For example, isotretinoin Accutane. Considering the 5 pregnancy risk categories of drugs, there are also 2 principles that always govern drug intake during pregnancy that both the pregnant woman and the healthcare provider must keep in mind. Any drug or herbal supplement under certain circumstances may be detrimental to fetal welfare. Therefore, during pregnancy, women should not take any drug or supplement not specifically prescribed or approved by their physician or nurse midwife. Second, a woman of childbearing age and ability should not take any drug other than one prescribed by a physician or nurse midwife to avoid exposure to a drug should she become pregnant. So we'll now move on to the most interesting part of this report: the medications to avoid during pregnancy. Some medicines are known to increase the chance of birth defects or other problems, but sometimes stopping a medicine, such as one that controls seizures, has greater risk to the mother and the baby than continuing to take the medicine. It is important that pregnant women be advised to talk to their doctor about any medicines to take if thinking about having a baby or if pregnant. Now this one is really important. Drugs used to treat heart and blood vessel disorders during pregnancy. The first one is antihypertensives. Antihypertensives needed by pregnant women who have had high blood pressure before pregnancy or who develop it during pregnancy. Either type of high blood pressure increases the risk of problems for the woman, such as preeclampsia, and for the fetus. However, antihypertensives can markedly reduce blood flow to the placenta if they lower blood pressure too rapidly in pregnant women. So, pregnant women who have to take these drugs are closely monitored. Drugs to lower high blood pressure, or hypertensives as you call it, may be several types of antihypertensives such as angiotensin-converting enzyme or ACE inhibitors and thiazide diuretics are usually not given to pregnant women. These drugs can cause serious problems in the fetus, such as kidney damage, inadequate growth before birth or growth restriction, and birth defects. Spironolactone is also not given to pregnant women. This drug may cause the development of feminine characteristics or feminization in a male fetus. Second is digoxin, used to treat heart failure and some abnormal heart rhythms, readily crosses the placenta, but at the usual doses, digoxin typically has little effect on the baby before or after birth. So that was hypertensives. The next is antidepressants during pregnancy. Antidepressants, particularly selective serotonin reuptake inhibitors or SSRIs, such as paroxetine, are commonly used during pregnancy. Use is common because about 7 to 23% of pregnant women have depression. For pregnant women, the benefits of treating depression usually outweigh the risks. Paroxetine appears to increase the risk of heart birth defects. So, if a pregnant woman takes paroxetine, echocardiography should be done to evaluate the fetus's heart. However, other SSRIs do not increase the risk. If a pregnant woman takes antidepressants, the newborn may have withdrawal symptoms such as inability and shaking after delivery. To prevent these symptoms, doctors may gradually reduce the dose of the antidepressant during the third trimester and stop the drug before the baby is born. However, if the woman has significant signs of depression or if symptoms worsens as the dose is reduced, antidepressants should be continued. Depression during pregnancy can lead to postpartum depression, which involves a serious change in mood and requires treatment. Now let's go to the most common teratogenic drugs. The classic example of a teratogenic drug is thalidomide, once liberally prescribed for morning sickness in Europe. Never approved for the use in the United States, thalidomide caused amelia or phocomelia, that means total or partial absence of extremities in 100% of instances when taken between the 34th and 45th day of pregnancy. Thalidomide is again available as it is effective as an anti-cancer drug, particularly with patients with multiple myeloma, so women need to be cautioned again about its detrimental fetal effects. Minoxidil, Rogaine, a drug taken by both men and women to restore hair growth, is an example of another drug that is documented to cause fetal deformities and could be rapidly available in a modern home. Valproic acid, a common drug prescribed for seizures, is yet another example. So, let's take a quick look at this picture which shows an infant with phocomelia. Now, let's move on to the use of social drugs during pregnancy. The first one is cigarette or tobacco. Cigarette smoking during pregnancy. Although cigarette smoking harms both pregnant women and their fetus, only about 20% of women who smoke are able to quit during pregnancy. The most consistent effect of smoking on the fetus during pregnancy is a reduction of birth weight or growth restriction. The more a woman smokes during pregnancy, the less the baby is likely to weigh. The average birth weight of babies born to women who smoke during pregnancy is 6 ounces less than that of babies born to women who do not smoke. Birth defects of the heart, brain, and face are more common among babies of smokers than among those of non-smokers. Also, the risk of the following may be increased: sudden infant death syndrome or SIDS, a mislocated placenta or commonly called placenta previa, premature detachment of the placenta or placental abruption or abruptio placentae, premature rupture of the membranes containing the fetus, preterm labor, uterine infections, miscarriages, stillbirths, premature births. In addition, children of women who smoke have slight but measurable deficiencies in physical growth and in intellectual and behavioral development. These effects are thought to be caused by carbon monoxide and nicotine. Carbon monoxide may reduce the oxygen supply to the body's tissues. Nicotine stimulates the release of hormones that constricts the vessels supplying blood to the uterus and placenta so that less oxygen and fewer nutrients reach the fetus. Because of the possible harmful effects of smoking during pregnancy, pregnant women should make every effort to not smoke during pregnancy, including discussing strategies with their doctor. Pregnant women should avoid exposure to the secondhand smoke because it may similarly harm the fetus. Next, alcohol during pregnancy. Drinking alcohol during pregnancy is the leading known cause of birth defects. Because the amount of alcohol required to cause fetal alcohol syndrome is unknown, pregnant women are advised to abstain from drinking any alcohol regularly or on binges. Avoiding alcohol altogether is even safer. The risk of miscarriage almost doubles for women who drink alcohol in any form during pregnancy, especially if they drink heavily. Often, the birth weight of babies born to women who drink regularly during pregnancy is substantially below normal. The average birth weight is about 4 pounds for babies exposed to large amounts of alcohol compared with 7 pounds for all babies. Newborns of women who drank during pregnancy may not thrive and are more likely to die soon after birth. Fetal alcohol syndrome is one of the most serious consequences of drinking during pregnancy. Binge drinking, as few as 3 drinks a day, can cause this syndrome. It occurs in about 2 of 1,000 live births. This syndrome includes the following: inadequate growth before birth or after birth, birth defects of the face, a small head or microcephaly, probably caused by inadequate growth of the brain, intellectual disability, abnormal behavior development, less commonly joint abnormalities and heart defects. Babies or children of women who drank alcohol during pregnancy may have severe behavioral problems, such as antisocial behavior and attention deficit or hyperactivity disorder. These problems can occur even when the baby has no obvious physical birth defects. Now, caffeine during pregnancy. Whether consuming caffeine during pregnancy harms the fetus is unclear. Evidence seems to suggest that consuming caffeine in small amounts, for example 1 cup of coffee a day, during pregnancy poses little or no risk to the fetus. Caffeine, which is contained in coffee, tea, some sodas, chocolate, and some drugs, is a stimulant that readily crosses the placenta to the fetus. Some evidence suggests that drinking more than 7 cups of coffee a day may increase the risk of having a stillbirth, premature birth, low birth weight baby, or miscarriage. Some experts recommend limiting coffee consumption and drinking decaffeinated beverages when possible. Now let's talk about aspartame during pregnancy. Aspartame, an artificial sweetener, appears to be safe during pregnancy when it is consumed in small amounts, such as in amounts used in normal portions of artificially sweetened foods and beverages. For example, pregnant women should consume no more than 1 liter of diet soda a day. Pregnant women with phenylketonuria, an unusual disorder, should not consume any aspartame. Illicit drugs during pregnancy. Use of illicit drugs, particularly opioids, during pregnancy can cause complications during pregnancy and serious problems in the developing fetus and the newborn. For pregnant women, injecting illicit drugs increases the risk of infections that can affect to be transmitted to the fetus. These infections include hepatitis and sexually transmitted diseases including AIDS. Also, When pregnant women take illicit drugs, growth of the fetus is more likely to be inadequate and premature births are more common. Amphetamines during pregnancy. Use of amphetamines during pregnancy may result in birth defects, especially of the heart, and possibly inadequate growth before birth. Bath salts during pregnancy. Bath salts refers to a group of designer drugs made from various substances that resemble amphetamine. More and more pregnant women are using these drugs. The drugs may cause the blood vessels in the fetus to narrow, reducing the amount of oxygen the fetus gets. Also, these drugs increase the risk of the following: stillbirth, premature detachment of the placenta, possibly birth defects. Next, cocaine during pregnancy. Cocaine taken during pregnancy may cause the blood vessels that carry blood to the uterus and placenta to narrow or constrict. Then, less oxygen and fewer nutrients reach the fetus. If pregnant women use cocaine regularly, risk of the following is increased: miscarriage, inadequate growth of the fetus, premature detachment of the placenta, premature birth, stillbirth, birth defects including brain and spinal cord, urinary tract, and bone defects. However, whether cocaine is the cause of those problems isn't clear. For example, the cause may be other risk factors that are common in women who use cocaine. Such factors include cigarette smoking, use of other illicit drugs, deficient prenatal care, and poverty. Hallucinogens during pregnancy. Hallucinogens may, depending on the drug, increase the risk of the following: miscarriage, premature delivery, withdrawal syndrome in the fetus or newborn. Hallucinogens include MDMA or ecstasy, rohypnol, ketamine, methamphetamine, and LSD or lysergic acid diethylamide. Next, marijuana during pregnancy. Whether use of marijuana during pregnancy can harm the fetus is unclear. The main component of marijuana, tetrahydrocannabinol, can cross the placenta and thus may affect the fetus. However, use of a small amount of marijuana does not appear to increase the risk of birth defects or to slow the growth of the fetus. Marijuana does not cause behavioral problems in the newborn unless it is used heavily during pregnancy. Next, opioids during pregnancy. Opioids are used to relieve pain, but they also cause an exaggerated sense of well-being, and if used too much, they can cause dependence and addiction. Opioids such as heroin, methadone, and morphine readily cross the placenta. Consequently, the fetus may become addicted to them and may have withdrawal symptoms 6 hours to 6 days or 8 days after birth. However, use of opioids rarely results in birth defects. Use of opioids during pregnancy increases the risk of complications during pregnancy, such as miscarriage, abnormal presentation of the baby, and preterm delivery. Also, babies of heroin users are more likely to be small. There are also other potentially or positively teratogenic drugs shown in this chart. Here it shows the category, example, drug use, and teratogenic effects. Now let's move on to potentially teratogenic vaccines. Live virus vaccines such as measles, HPV, mumps, rubella, and poliomyelitis, or the Sabin type, are contraindicated during pregnancy because they may transmit the viral infection to a fetus. Care must be taken in routine immunization programs to make sure that adolescents about to be vaccinated are not pregnant. Women who work in biologic laboratories where vaccines are manufactured are well advised not to work with live virus products during pregnancy. So we'll move on to the final part, client teaching. Many expectant parents are willing to make changes in lifestyle to avoid adversely affecting the fetus. For prescription and over-the-counter drugs, advise pregnant women to consult with their healthcare providers before taking any drugs. This applies to OTC drugs as well as prescription drugs. Some non-steroidal anti-inflammatory drugs such as aspirin should be avoided because they may increase bleeding. When prescription drugs are necessary, the healthcare provider weighs the risk against the benefits to decide if a drug can be used safely or if changes are necessary. Drugs taken during the first trimester are of particular concern because of the risk to developing fetal organs. Complementary and alternative therapies. Some complementary and alternative therapies are very safe and helpful during pregnancy. It is estimated that over 1/3 of pregnant women in the United States use common or some type of alternative therapies during pregnancy. And many of these are seeking treatment for back pain. So it's actually the same also with the pregnant women here in our country. So as we notice, some of women use essential oils or other kinds of oils to massage their back and even some on their abdomen, which is contraindicated by doctors, and that is to relieve the discomfort they feel on their back and on their abdomen. Many have not been studied adequately. Ask about any complementary or alternative therapies used and advise the woman to discuss them with their health care provider. For alcohol, no amount of alcohol consumed during pregnancy is known to be safe. Therefore, the best advice for women who are pregnant or who plan to become pregnant is to abstain from all alcohol. Illicit drugs. Use of so-called street or recreational drugs such as cocaine, heroin, and methamphetamines is harmful to the fetus. Advise the pregnant woman to seek help to discontinue all illicit drug use. Immunizations. In general, immunizations with live virus vaccines such as measles, mumps, rubella, and varicella are contraindicated during pregnancy because they may have teratogenic effects on the fetus. Inactivated vaccines are safe and can be used in women who have a risk of developing diseases such as tetanus and influenza. Inactivated influenza vaccines is especially important for women who are pregnant during flu season because they can have serious complications from the disease. It can be given at any point in pregnancy. The Centers for Disease Control and Prevention, CDC, recommends administration of the Tdap vaccination between 27 and 36 weeks of each pregnancy. So, that's all about the medications to avoid during pregnancy. Thank you.